This is my audience. I'd like to introduce you to Novell Strump. He worked with the University of Pennsylvania. He was involved in a 4-year study that comprised of 375 elderly patients. They all had cancer, they were in the hospital for surgery, and they were sent home. Half of the patients had the normal routine care that you get once you leave the hospital. The other half had specialized care by advanced practice nurses. The advanced practice nurses received the sickest of the 375 patients, and you would have thought that they would have passed away sooner. But the fact is they lived 7 months longer because of the specialized care that they received from these nurses. This study linked that improved survival of the post-surgical cancer patients directly with the advanced practice nursing care. Advanced practice nurse is also known as APN or APRN. The terms used interchangeable, and it is a licensed RN who has completed graduate training as a clinical nurse specialist, a nurse anesthetist, a nurse midwife, or a nurse practitioner. And I'd like to tell you a little bit about their education and their role in healthcare. Usually, in order to proceed to these advanced practice nursing, you have to have a BSN, and then the education requirement of the National Certification Agency setting and the scope for each advanced practice nurse's role. The 4 roles of the advanced practice nurses are the clinical nurse specialist that I already told you about, the CNS, the nurse anesthetist, the nurse midwife, and the nurse practitioner. The clinical nurse specialist, also known as CNS, has earned a master's or doctorate from a program that prepares the CNS. According to the APRN consensus model for regulation, the CNS has the primary goal of continuous improvement of patient outcomes and nursing care. The nurse anesthetist is an APN that administers anesthesia. The nurse midwife is a specially trained nurse that goes with a woman through her entire aspect of pregnancy. These women are low risk for complications. A nurse practitioner is an RN that has clinical education beyond that of the generalist role. According to the International Council of Nurse Practitioners, an APN is a registered nurse who has acquired the knowledge base, expanded practice of which would be determined by the context in which he or she is credentialed to practice. In other words, it depends on their specialty whether they want to work with neonatals, which is baby, or geriatrics, which of course is the elderly. Autonomy of advanced practice nurses is important because they're out there, they're the front line, and they make decisions all the time by themselves. Autonomy is the ability to self-govern, to make decisions separately from others, and the role of autonomy in APNs is not a clear path, because just as nurse practice acts differ from state to state, so does the autonomy that they give them. California is the most liberal of all the states, and their Nurse Practice Act defines nursing practice as care ordered by physicians. Texas states that they perform acts delegated by a physician. Missouri actually has a collaboration where it's a written document between the physician and the APN, which tells them exactly what they can do. The doctor's telling them what they can do while they're not there. Although in Missouri you do have to be with the physician for at least a month before you can work on your own. APNs in healthcare, according to the American Nurses Association, whether they're a nurse practitioner, a CNS, an anesthetist, or a nurse midwife, they play a pivotal role. They are often the primary providers and are at the forefront of providing preventative care to the public. Their current role in healthcare reform includes the Affordable Care Act, which made provisions for them to include independent home visits, as well as increase their reimbursement from Medicare. In conclusion, I'd like to leave you with this. According to Furlong and Smith, who are forerunners in advancing the practice of nursing, the core concepts of the advanced nursing practice role are autonomy and clinical practice, pioneering professional and clinical leadership, expert practitioner, and research. To achieve these core concepts, the advanced nurse practitioner must develop theoretical and clinical skills to meet the needs of the client, the family, and the community. Thank you.